Inclusion.
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 Inclusion. Inclusion.
Inclusion podcast by the Centre for Inclusive Leadership.
Welcome to Inclusion Podcast. My name is Chantelle Dusette. Happy New Year to you. I hope you all had a fantastic festive break. What better way to start the new year than talking about inclusion and well-being? Really hope you enjoy this episode. Welcome. Happy New Year to you both.
Happy New Year to you.
Happy New Year. Thank you.
Thank you so much for joining us today. So we have Hannah Meredith, who is Health and Wellbeing Partner for MVF, MVF Global, and our Chief Emotional Officer, Paul Anderson-Walsh from the Centre for Inclusive Leadership.
Good to be with you.
Hello. Do you feel refreshed after?
Yes,
Yeah?
I do. Yeah, ready to start everything again, and all my New Year intentions, which there's many of every year. But yeah, feeling good.
I like New Year intentions. I like that. That's nice. That's a nice little.
I like to set
let's mix it up
intentions
a bit.
on New Year's Eve. Yeah, going into the new year with
Oh, do
things that you
you?
want
Yeah,
to
that's
do.
kinda
Yeah,
cool.
we do like a big plan and drawing and things what we want to do. So
Yeah, intentions rather than resolutions. to some extent.
yeah, I think so. I think it feels more positive.
I really
Yeah, I
like
like
that.
that.
So
I
you
think
sit
that's
down. Who does that? Is it just you, or who did you?
My partner chose
You just sit together. Wow.
Yeah.
And then you just write it all out, what you want to do.
Yeah, and use
your
coloured
intentions.
pens and, make it pretty and artistic and,
Oh, look
It's
at
normally,
that.
walking and more healthy habits and things. But yeah.
I love that. See, I like that. See, my thing is about New Year's revelations, which is what I like.
Oh, I like
Like that.
that. Yeah, that's
Yeah,
cool.
New Year's
I like that.
revelations. What am I going to become aware of this year that I wasn't aware of before? That's what I like.
I like this. This is so great. I mean, so mine is I also do have a New Year's Eve ritual, if you like. And I just get a blank piece of paper, and I always do it sort of at midnight, and I sign it and date it, and it's just me saying to the universe, I'm just open to whatever happens
Oh,
this year.
cool.
Yeah.
I've
That's
signed
love
it.
that.
I've signed it off,
That's nice. Like
and
that.
I'm open, and that's kind of
It's amazing.
But-
Whatever gifts the universe brings you, that.
yeah. And then by the end of the year, I'm thinking, why is this happening? And I'm like, I did actually sign
You
it all
asked,
off, actually,
yeah.
so I can't really got no.
Got the proof.
Be a bit more specific next year.
Yeah, exactly.
That's right.
To anything.
Didn't you learn anything from your
I
letter to
literally
Santa
asked.
Claus?
No, exactly.
It's amazing. I love that.
Oh, this so it's. I mean, rituals is that's something that we do, isn't it? And it's part of what keeps us going as well. And I'm thinking about that in terms of January, because people do focus and they kind of knuckle down and think, okay, so it's January. Sometimes people, abstain from certain things. Sometimes people do more of certain things, whatever it might be, which I think is quite interesting that we, the way that we operate as people, how we kind of function in that way. I think I'm going to start with the question I was going to ask you last first because of where we've gone. What are the things do you think you can do, Hannah, during these winter months to sort of really take care of your mental health, do you think?
Yeah, I think for me, one of the biggest ones is getting outside every day. And I try to start doing that from October onwards every day. So you need to be actually in the light, I think. There isn't much light, obviously, in the winter months, but trying to get outside into the fresh air and into the light wherever possible. I do quite strange things, like I don't wear sunglasses and I try to let the light hit my eyes. I'm not a doctor, so I'm not recommending you do that, but I read that you need to...
Don't try this at home.
Yeah, don't try this at home. I'm not a medical professional, but you need the light to actually hit your retinas in order to turn the vitamin D in your body into energy. So
Really?
I do things like roll up my sleeves and sort of look not directly at, but let the sun, like I was doing it outside, today because it's a sunny day today. So do things like that. I take vitamin D supplements as well. I start taking that in September. And I think socializing as well, when you can feel like you want to sort of hide away, but actually being with people that you love can really lift your spirit. So, and of course, exercise and eating well as well will kind of help combat the sad feelings.
And
Yeah,
that really is a thing, isn't it? That seasonal
Yeah.
adjusted thing. That's really, it's
it
really
is.
interesting.
It affects people.
Yeah.
I see it in my job a lot. Sort of people's, mental health really kind of declining and more mental health related absences in those winter months as well.
Do you know, it's interesting. I've done quite a bit of work over the years in Scandinavia. So I'm thinking particularly of places like Finland and Norway and so on. And what's interesting is when you go there in the winter, it's like 23 hours a day, it's dark. And I think I'm right in saying, somebody correct me on this if I'm wrong, but I think I'm right in saying they've got the highest suicide rate in the world, right?
Yeah.
It's no surprise, right? So you either get 23 hours of darkness or 23 hours of light in the summer, and that is nuts. So you can be coming home from a restaurant or something at midnight, and it's like 3 o'clock in the afternoon. But the fact that there's no light through that whole winter period is really, really interesting.
Clearly impacts when you look at those stats. It must, it's a direct correlation, isn't it? So yeah, it really does impact. But I think we're sort of lucky where we are in the hemisphere that it's not quite that bad. But it's still quite a drop off.
But it draws in though, right? It's still it draws in on that, doesn't it? I was looking at some history stuff recently. They were saying it's 70 years since the Great Fog of London, and that whole problem that caused for us. It was just the smog. You couldn't see. Couldn't see the end of it.
So there was no light getting through.
That's right.
At all.
Really interesting.
Yeah. So for me, those little things I think do make a difference. But just trying different things that work for you as well. But I think being outside and getting out every day really helps.
I think that's really, it's a really good tip. That's really important, just getting out during the day and sunlight being a key factor in that, because especially people that work from home, you just kind of get stuck at the laptop. So actually just being able to get out, even if it's for 10 or 20 minutes and having the light hit you, I think is a really important thing. And just walking in general, because, when it gets cold, you just feel like, I just want to be indoors under a duvet. But actually, the thing that's going to help your mental health is to be outside, be in the light, even if it's a bit cold. Just having that contact is really healthy for you. And then thinking about your food as well, which is really key. Your diet and exercising as well. And even if you can't face, going for a run in the cold of the morning, or whatever it is, you can gym at home. So many ways you can
get the endorphins going. Definitely,
which is great.
And I think working from home as well, with the blue light from from screens that we're in front of so much now, there's sort of blue light that's emitted from those that's interacting with our circadian rhythms all the time, and then that can impact on our sleep. So it's not good. You need to kind of limit that time if you can as well.
So, let me just ask a quick question on that. So I remember reading last year a really interesting, it was during the pandemic actually, it was a fascinating comment that somebody had written, and they talked about the shift that we'd moved from working from home to what they called homing from work, which I thought was an interesting thing to say. How much of a problem is this now, given that we are, to the screen, or just all that? What can we do about that? Is there a way to having some discipline around it?
I think you have to be very strict with yourself, but it's obviously really hard, because if you're working 8 hours a day, 7-8 hours on your screen, and then obviously in the evenings you're generally interacting with your friends, or socializing on your device, and then watching stuff probably as well on a screen. I saw some really terrifying infographic of what we'll look like in 20 years, and it was like, everyone was really hunched over and just completely, our posture and everything was really wrong. I don't know how accurate it is, but it was terrifying.
The bendy neck that flops down.
The tech neck and all of this. So I think, posture is a really important one that you've constantly got to make sure you're sort of correcting yourself when you're working, and making sure DSE, you've got the right DSE set up. It sounds so basic, but laptops are actually terrible for our ergonomics and for our, our spinal health and everything, because you're sort of hunched over like this. So, trying to do those kind of simple steps to counteract all the time, and just being aware that it's quite unnatural to be doing those movements for the length of time that we're doing them as well.
There's that image of the sort of evolution of man, where you have these, they have the idea of the caveman, and then they kind of grow up, and then they go right down to be the tech man. Yeah, I've seen that before.
It's horrible. It's
terrifying. That is a frightening job.
I hope that doesn't happen.
So what brings you to this conversation on well-being, Hannah? What brings you to the well-being conversation?
So I have lived experience of mental ill health. So I was diagnosed with anxiety when I was 30. but also growing up in a household with mental ill health as well. So I sort of draw on my own lived experience, I guess, to really sort of bring a unique perspective and passion to the spectrum of well-being. And that obviously relates to the job that I'm doing now, which is Health and Wellbeing Partner at MVF. And I've been doing that since 2017, and I've been the sole creator of the Health and Wellbeing strategy there. So it's a multi-award winning strategy, and it's kind of multifaceted. So it's all about social wellbeing, mental health, physical health, financial wellbeing now as well. That's the latest one.
Wow.
So yeah, I've been doing that for a good few years now.
That's great, because I've seen you carve that role out, and what you've turned it into is just absolutely incredible. And I know that as someone who benefited from your work, a few years ago, in terms of the wellbeing offer that you created, and it was just everything from yoga, sports that you could do during the day, massages, getting your nails done if you wanted to, meditations, gong baths. I mean, it was just endless, everything that you did, and people really responded to it. And it was it's just so helpful to reset, so you can then get back into your day and be refocused and replenished. And I think if I think of you in that time, and where I think you probably still are now, why everyone loves you so much, is this, that your whole thing is about wanting to, I feel, is part like wanting to nourish people, like making people feel whole. And that's what I feel comes through. And it's no surprise, that you were this year's winner for the most inspiring employee, of the year, for the Great British Workplace Wellbeing Awards. Sorry.
Thank you.
I said that rather clunkily, but we will put that in some text so people can read it. But I mean, it's just incredible, because competition is fierce in there. But I just know from it, everything that you do in that role is just so in keeping with who you are as a person. It's very aligned to who you are, and I just feel that just comes through in everything that you do.
Thank you so much.
Just absolutely incredible. So, and then to hear the story, the origin story. Oh, it's true. I'm just,
Yeah, thank you. It's it's definitely been a journey for me, because it wasn't an established role, and I had to kind of embed that myself. And obviously you've got all the things that go alongside that, like imposter syndrome, and not having an official degree in order to do this role or anything like that. So it's definitely been a journey, but I feel like I'm kind of owning it now, and it's all sort of slotting into place, and the kind of fruits of that hard work are paying off now, and with the strategy. And we obviously did a lot of work before the pandemic as well. We launched the strategy ahead. We were kind of ahead of the curve, and part of that obviously is due to Ange, our fantastic CPO as well, and having that vision. So that really set us in a good place, I think, once the kind of COVID pandemic hit. So we're really lucky.
But it's interesting, because obviously we're fortunate to be able to work with you as one of our clients. And what is really interesting is when I see organisations that take this seriously, and that's the point I think that Chantelle's articulated, that the way you went about it, the way the offer has so much integrity. So I'm absolutely delighted about these awards for you. That's so good. But it feels like it's Chantelle's nourishing point is right, but it also feels like it's such a passion project for you as well.
It is.
And that it has to be, right? It has to be more than just, it's a job, a role, and somebody's got to do it. It's a passion project.
Yeah, I think so, because these roles, these jobs, they're not easy things. It's like inclusion as well, and they're a hard thing to do. And
they're really difficult.
And sometimes it can be hard to convince people, that it's needed. So you've got to have that passion to drive you. Otherwise, it's not going to work.
It's wonderful.
How do you think they align, the inclusion, the well-being conversations? How do you feel that they align?
I think it's an integral part of the inclusion conversation. So for me, the whole idea of well-being and inclusion sort of sit together, because I think well-being sits, and you talked a lot about the sort of the mental, physical well-being. There's a whole kind of issue that I think we would want to explore around psychological well-being, what those aspects are. But I think part of psychological well-being is linked to the notion of whether or not I feel a sense of belonging, whether I because issues around loneliness, issues around burnouts, issues around performative culture. A culture that is an inclusive culture has at its heart, I think, well-being. It sits at the very heart of it. Why? Because what it's interested in is it's interested in creating a space where essentially we can say, in an inclusive space, and Hannah, would you agree with this?
Yeah.
In an inclusive space, the idea is that everybody comes into that space and we all sort of hang our masks on the door and we help each other be human. And that's a real well-being conversation. How you do that is really very fundamental. So that might be, well, you're the guru, so you'll tell me. But I do think it's inextricably linked. So I think I would say there are things that you think about, so for example, performance or loyalty or discretionary effort, volunteerism, all of those things. Within that family of things, the thread of that is, do people have a sense of well-being? And I think interestingly, in an environment that is more excluding and more unhealthy, you often sacrifice your wellness, and that's sacrificed at the altar of performance or acceptance. You have these problems around presenteeism and all this kind of stuff. And I think those are real hallmarks of a diseased organization. Whereas I think when you have a well organization, you really see this is something that's cherished. Why? Because if your organization depends on the discretionary efforts of people, then you need those people to be well. If your view is that humans matter. If you have a view that says, well, they're just fodder, we can just churn them over, then fine. A lot of organizations burn people like that.
I think you made a lovely point about, I think what was it you said about, thinking about if you see your people, as sheep, do you want mutton or do you...
Yeah, I think that's the point. It's a shepherding point. So the question is, as a shepherd, what do you want your sheep for? Do you want them for wool or do you want them for mutton? If you want them for mutton, well, just send them to the slaughter. But if you want them for wool, you've got to take care of them. And if you're trying to get more and more over time, then the way you care for your people is fundamental. And I think there is I think this is such an interesting conversation, because I think one of the post-pandemic issues, I think, is there's been a bit of a reaction to people saying, hold on just a minute, we're not really interested, whether it's MVF Global or whether it's anybody else, we're not interested in your goods and your services unless we know you're in the business of service and good. And one of those fundamental ways that I can tell you if you're in the business of service and good is whether or not you, and here's the point, do you as a business love people and use things, or do you love things and use people? An organization that loves people and uses things must have a well-being focus, right? Because how is that going to work otherwise?
100%. I mean, people are your business. So if you're not looking after them, you're not going to be as profitable, as successful. If you want to, turn it into that kind of ROI argument. But I think for me, I absolutely agree with what you said, Paul. Like, they are intrinsically linked. You can't really have well-being without inclusion, or inclusion without well-being.
Completely.
If you're not being included, if your needs aren't being met, then, or even simple things like you're not being addressed in meetings, or your brain actually switches to social cognition, and that means that you are scanning your environment for perceived threats all the time. So you're not able to, think critically and focus on the task in hand, because you're, looking around for these things subconsciously, obviously. But then what happens over time is that it degrades your psychological well-being. So, and I think when you're thinking about a well-being strategy, you need to think about everybody's from a different starting place and everybody has different needs. So an effective wellbeing strategy needs to really consider all different perspectives and the diversity of your employees as well. So
it's got to be equitable, right?
100%. And they're symbiotic. I think for me, they go hand in hand. You can't you can't have one without the other.
And I mean, you've touched on this already, but the business case for inclusion and the business case for wellbeing, there is a business case for it, isn't there? Even if people think, well, I'm not sure if I can get into it in terms of I need to love my people or whatever it might be. But obviously, if you've got people in your team, I think you should care for them. Otherwise, why manage them, you know. But
Absolutely.
that aside, you know, the business, there absolutely is a business case, isn't there, for wellbeing and for inclusion?
Yeah, 100%. I think on a basic level, it's the right thing to do, like you say. You know, it's the right thing to do to invest in these things. But for me, they should be at the heart of business decisions, really. And I think where our governments are failing us, businesses and organisations have even more of a responsibility to step in now and to provide enough support and good support as well for their employees, for sure. So I think there are many, many business cases that you can make. You can look at, you know, absence data, attrition data, and, you know, turn that into a good business case for investment. But I think just morally, it is the right thing to do as well.
Yeah.
The moral case is irresistible, right? But I think the logic is to this rather more cynical point. The logic is that people that feel well do well. Right? So I don't think you can disassociate those two ideas in my mind. And I think if you just think about it in that simple sense, that I'll do better if I feel better. And that seems to me to be quite an obvious point. And I think if you think about well-being and you pull it forward, you pay it forward a bit, you can make an interesting connection. This cognitive impairment piece you talked about, you can make a connection, can't you, between well-being and engagement. So just think, just at a logical level, people that feel well and are embraced and are embracing and feel that welcome and have that ability to pause and do all that good stuff you want people to be able to do, they're more likely to be engaged than people that are stressed and are maxed out and are burnt out and are exhausted and don't feel valued. Well, Deloitte's have got some numbers for us if we want numbers, right? So, and the numbers are simple. Engaged people are 57% more effective in role than disengaged people. And engaged people are 87% more likely to stay than disengaged people. So it's pretty straightforward, right? If you want someone to live in the heart of your organization and to have your organization in their heart, then you have to have a heart for those people that are in your organization. And that correlation seems to be like, what is it about that you don't understand, Mr. Corporate person? Do you know what I mean? It's so obvious, right?
Yeah.
It's obvious.
Hannah, just leading on to that, what is it that you do to look after your employees at MVF?
Wow, what don't we do?
I mean, I know I mentioned some of them, but what?
Yeah, well, we have a full wellbeing strategy that's been in place, as I mentioned, since 2018, and it is multifaceted. So it has 6 elements that are, mind, move, space, give, all to do with sort of our CSR and charity days.
Really nice.
And I'm going to forget some, money, which is the latest one to be added, and connect as well. So it's all about the whole kind of spectrum of wellbeing, really. So within each of those elements, we have an array of benefits, policies, activities that kind of fit into the elements and that people are able to access. So we have counselling available to us. We have lots of partnerships with fantastic providers that offer one-to-one specialist support. So things that people might go through, such as menopause or issues with their children. So Parent Cloud are one of our providers, and they offer brilliant services to our employees. We also have lots of kind of apps. So we have Headspace partnership, a partnership with Thrive as well, who do sort of CBT and they're NHS backed. We have recently launched a partnership with a financial wellbeing platform. So we've launched a cost of living crisis proposal that's supporting our employees through this kind of really difficult time at the moment. And so financial wellbeing is the latest kind of element to be added. And the platform offers kind of help with coaching journeys to achieve financial goals, but also track and manage your spending, one-to-one coaching as well. We offer manager training, mental health first aiders, obviously all of the physical activities that you mentioned earlier. We do yoga every evening, there's badminton and all sorts of things you can do. So it's a long list, I won't mention them all. And then obviously our offices are fantastic and you've been into them, and
you got great space,
wellbeing is at the heart of the design as well. So we've got the Zen zone and all of this stuff that you can kind of break out into as well. So there's a lot.
But this is important, right? Because this is a real message, I think, that to clients is that this is serious. You know, you have to really invest in this. It's a really, really good plan. Wonderful.
Yeah, if you want to embrace your staff, you have to embrace well-being and
Yeah,
inclusion.
yeah.
Absolutely.
Yeah.
It's key, critical. I have one more question for you both. In general, what do you do to look after your well-being? And this could be anything. I think I've been on a bit of a journey in terms of well-being. And I've learned I'm introverted and things of that nature. So now, you know, I think I was invited to a few events last week, and I decided the ones I wanted to go to. And I said, actually, you know, this one event, which would involve being more sociable than I was maybe feeling in that week, I said no, because I just didn't feel like I had the energy for doing it. And for me, that was a note for me to think, oh, actually, that's part of my well-being journey, to say no to an event. As much as I get what you were saying at the beginning, I think being sociable and, you know, sharing time with people that you love is great for your health and fantastic. But I think sometimes, you know, we get invited to so many different events and we feel like we can't really say no. But actually, I said no, and my friend said, well, why was that? Why are you saying no? And I said, I just feel like I need to just sit indoors and just be. And he was like, I really respect you just saying no for that reason. You know, just saying, actually, I just need to just reset.
Having those boundaries, I think, is really important as well.
So what do you do, in terms of your kind of well-being? What do you do? What are your well-being markers?
it's a constant work of art. But I guess I've always been really sort of into all these sort of weird and wacky things that you can do and try anyway. But for me, sort of with my mental health illness, that was kind of getting the right support and getting medication, and that really worked for me, and having therapy. So that, you know, I'm really lucky now that I'm able to kind of manage that medication free at the moment, which is great. But in terms of well-being, I think it's, I guess listening, really tuning in and listening. Like you say, sometimes I might need to be alone and take that time out, but sometimes actually being alone is really bad for me. So just kind of constantly checking in with myself, and always sort of making sure I'm recharging, I suppose. And especially with the job that I do, it's really important, I find, to be replenishing myself when I'm kind of listening a lot to other people and giving a lot to others. So getting out in nature, huge one. Exercising, and trying new things, I guess. But Kundalini yoga's been a massive one for me, actually. For my mental health and for my well-being. Because it's kind of breathing techniques, and it's creating physical changes in the body that eat away the stress hormones and things. So, but I'm always doing strange, wacky things.
Sounds great. Sounds great.
How about you, Paul?
I can't. This is the queen of well-being, right? So I'm going to give you this pathetic list. Really.
I don't eat white bread anymore.
Or white sugar.
That's great. That's really important.
So I read a program a little while ago for our managing your own inclusion series, and the model is with me. You will know, everything's got to have an acronym, and this program's called Thrives. And I suppose two of the things from the Thrives program, I think, are things that I've kind of taken on for my own journey. The T is about making sure you have more therapeutic friends than toxic ones. And I think that's an interesting thing from my perspective, because I think that's about saying there are a lot of people that lean, but how many people lift? And I think it's a question of saying, do you have people that lift you as well as people that lean on you? I'm okay with people leaning, but there needs to be some people that lift. And I think the other thing I think about a lot from that well-being piece, from that Thrives model, is the I. And the I is about making sure that one is passionately involved in things, but not attached to them. And so I think that for me, from a well-being point of view, clinging is always the problem. Attachment's always the problem. And I think the only other thing I would say to that is that I like to try and find opportunity to turn up the quiet, and, you know, sort of be quite meditative and quite reflective, and read, and just do kind of non-demanding things. But it's very challenging. But certainly the T and the I in Thrives are really well, actually, the V is a big point for me as well in the thrust, but I could probably go through the whole model.
Yeah.
But those things are important. But I think maybe the V actually is worth just signing off on for me, because the V in our model is about living by a set of values, not for validation. And so I think that whenever I start to try and validate myself with whatever it might be, clients, friends, whatever, that exhausts me.
Yeah.
But when I live by, it's really draining. But then when I'm living by my set of values, I find that much more regenerative and self-sustaining.
Yeah.
So I think those would be my things.
That's great. Thank you. And I hope that gives people a lot to think about as well, which would be helpful. Thank you. It's been so great spending this time talking to you both.
Oh, an honour. Thank you.
Thank you.
Yeah.
Thank you
for being
both.
with us.
Great time. Thank you.
Thank you for joining us on this episode of Inclusion Podcast. Remember to like and share, make any comments you would like. And we're looking forward to seeing you on the next one.